Well, knee replacement is a very successful operation, but unfortunately, sometimes people fall and they break the bone around the knee replacement and then they need treatment. And that's what I'm going to talk about in today's video, so stay tuned. Welcome back, I'm Adam Rosen, and if you have not already subscribed, please subscribe, and if you like this content, click the thumbs up button, and be sure to check out my book, The Knee Book. In today's video, I am going to talk to you about broken bones, and specifically broken bones around total knee replacements. Now, knee replacements can fail, but it's extremely rare for them to break. Most of them are made of metal. Plastic can wear out, and there are some new knee replacements that are sort of on the cusp of coming out, made of ceramic, and there is the potential that a ceramic implant could break. But for the most part, what we're going to talk about is talking about bones that break around knee replacements. Now, you can break the kneecap or the patella, you can break the shin bone or the tibia, but in today's video specifically, I'm going to talk about the more common injury that we see are fractures at the end of your thigh bone, what we call distal femur fractures. So these are fractures that occur just above the thigh bone component or the femoral component. And this can occur from any kind of trauma. It could be a car accident, could be a fall, and it is an increased risk of happening if you have osteoporosis, which a lot of older patients do if they have a knee replacement, especially if it's been in for a long period of time. Now, when we see patients that have a fracture, what we call a periprosthetic fracture of the end of the thigh bone, there are a number of ways that we can treat this. Now, in some instances, we will treat this conservatively, so either a brace or a cast. This is used in very select patients. So usually you'd have a very tiny little fracture that hasn't displaced, maybe it hasn't even completed all the way through, and you can maintain not weight bearing on the leg with crutches. That might be an option. The other option, and more frequently if we see patients that get conservative care, these are elderly patients, sick patients, patients that may not be ambulators, they use a wheelchair, they're bedridden. Because if we put the leg in a cast, in the orthopedic world, we say stiff is stable. So if you hold the leg straight for many, many weeks or months to get the fracture to heal, the knee joint is going to be extremely stiff. So conservative care is an option. But more frequently, there are a number of surgical options. So in this particular case, the person broke the end of the thigh bone. And when we look at these fractures, there are different types of fractures that we use to assess what's the best implant choice available. The important thing for us is figuring out if the implant, the thigh bone part, is still stable to the end of the bone. And if so, one of the options is putting on a plate. Like in this particular case where we put a plate on the end of the thigh bone, which held the bone together and allowed it to heal. Now, sometimes people fall and have similar fracture patterns. In this particular case, we need a knee replacement that has what we call an open box. So between the ends of the thigh bone, the condyles, there's a space. Sometimes that's a closed space with metal. Sometimes it's an open space. We call that an open box. And in those particular knee replacement implants, we can pass a rod through the box into the inside of the thigh bone and put screws above and below to hold the thigh bone in place to allow it to heal. This is called intramedullary rodding. Now, another newer technique, which I don't have a picture for you today, but one of the techniques is doing dual fixation. So what some doctors are doing nowadays in certain patients is doing both a plate and a rod to make it a more stable construct, allowing you to walk on it earlier and preventing it from displacing. So that's an option. Now, there are certain patients that have fractures of the end of the femur, but the thigh bone part, the knee replacement portion that attaches to the end of the thigh bone, has become loose. And in those cases, we have to fix the fracture, but also address the fact that the knee replacement part is not adhered to the bone. So in these particular cases, we do what's called a DFR, or distal femoral replacement. So this is basically replacing the entire knee replacement because this distal end, basically it's like my fist, makes up the entire end of your thigh bone. It's completely made of metal. And to do that, we remove the bone, we remove the implant. We also have to remove the ligaments. So the thigh bone part links together with a hinge to the shin bone part. So we have to replace the shin bone part, and we put longer stems or rods inside the bone to bond this thing together, and this allows patients to stand and walk earlier. Now, what is the best treatment? that is up for debate. If you talk to a lot of trauma surgeons, so if you're at a center where there's a trauma surgeon, more trauma surgeons are going to try to preserve the knee replacement and fix the bone with plates or rods or both. Total joint replacement surgeons sometimes will choose to do the distal femoral replacement because it essentially gets rid of the fracture. It allows you to put full weight on the knee right away. But it's not a great choice for younger patients because those implants do not last as long as regular knee replacements. So it's reserved more for elderly patients, especially where the bone stock is very, very soft, but it at least allows them to walk on it sooner. So there you have it, kind of a short video on what happens if you break the end of your thigh bone and you already have a knee replacement in place. These are the techniques and surgeries that we use to put the bones back together. And thanks again for watching. I'll see you next time. Stay safe.